is for the country to become a prosperous middle-income country by the year 2030 and is amplified in our 7th National Development Plan. To achieve this goal, government remains committed to ensuring that universal health coverage is attained, leaving no one behind, using a primary health care approach across the continuum of care, which includes primitive, preventative, curative, rehabilitative, and palliative interventions. Government has also embarked on safeguarding public health security through the enactment of the Zambia National Public Health Institute Act number 19 of 2020. Strengthening public health security is cardinal in addressing all the core capacities, capabilities, and technical areas needed to contain epidemics and pandemics within the country and across the borders. Mr. Speaker, currently, Zambia is grappling with a global COVID-19 pandemic. It is just slightly over 1 year since the first COVID-19 cases were reported in Wuhan City, China, and approximately 10 months from the time that Zambia recorded its first 2 cases. The COVID-19 outbreak, which was declared a global pandemic by the World Health Organization on 11th March 2020, continues to evolve and has become complex and dynamic in its presentation and management. Its catastrophic effects on human life and country economies cannot be overemphasized. Mr. Speaker, I should also hasten to say no country or healthcare system in the world was ever prepared for the COVID-19 pandemic, and the result has been overwhelming of public health systems across the globe. Mr. Speaker, following the confirmation of 1,256 cases, new cases, out of a total of 10,730 tests performed in the previous 24 hours, as of today, 3rd February 2020, Zambia has now crossed the 50,000 cases mark. The cumulative number of COVID-19 cases recorded on this date is 57,489. Sadly, 10 new deaths were recorded in the last 24 hours, hence bringing the cumulative number of deaths to 804, classified as 364 COVID deaths, 411 as COVID-19 associated deaths, and 29 deaths are pending classification. A cumulative number of 50,479 people have recovered since the beginning of the outbreak as of today, 3rd February 2021. As you can see, our recovery rates are quite encouraging, with up to 88% of cases recovered to date. We currently have 6,206 active cases, of which 5,771, that is 93%, are under community management, and 435, or 7%, are currently admitted to our COVID-19 isolation facilities, with 296 on oxygen therapy and 46 in critical condition. That is about 11% of all admitted cases are in critical condition, and 70% of all patients admitted in facilities require oxygen support. This highlights the demand on our health services that this pandemic is creating. The disease, which initially affected mostly the elderly and those with underlying conditions in the first wave, is increasingly being noted among young people, especially during this current second wave. Mr. Speaker, the government of His Excellency Dr. Edgar Chagwa, President of the Republic of Zambia, continues to use a multi-sectoral approach to respond to the COVID-19 pandemic. Various well-coordinated platforms are in place to ensure technical and policy aspects of the response are managed efficiently and effectively. The coordination platforms include 1, the National Disaster Management Council of Ministers, 2, the Interministerial Multisectoral Committee of Permanent Secretaries for Disaster Management, 3, the Epidemic Preparedness, Prevention, Control, and Management Committee at national and subnational levels, and 5, the Public Health Emergency Operations Center at the Zambia National Public Health Institute. A COVID-19 National Multisectoral Contingency and Response Plan has been developed that outlines the various strategies being employed for mitigating the outbreak. The plan is reviewed and revised regularly depending on current and prevailing evidence as well as the trajectory of the pandemic. Currently, this plan is being updated through the leadership of the Disaster Management and Mitigation Unit, DMMU, and with support from cooperating partners. The Ministry of Health is using an 8-pronged approach to control and prevent the outbreak from spreading, and this includes the following. 1, surveillance and case management. 2, surveillance and case finding, 2, case management. 3, infection prevention and control. 4, risk communication and community engagement. 5, laboratory diagnosis. 6, logistics and supply chain management. 7, appropriate, competent and adequate workforce. And 8, routine essential health services. Mr. Speaker, the first wave, characterized by escalated number of cases, increased hospitalization, and high number of deaths, was experienced between July and early September 2020. Zambia experienced reduced cases and deaths from mid-September to early December 2020. But unfortunately, as anticipated, we were hit with a second wave, which began in the second week of December 2020. This period, Mr. Speaker, coincided with the festive season, a period when there was increased gatherings by families and friends, including those who travel from abroad. Poor adherence to public health measures, including lack of masking up, crowding, poor hand hygiene, and law enforcement to adherence of these interventions in public places, compounded by low temperatures, are associated with the outbreak in this increased wave. During this second wave, a new strain of the virus that causes COVID-19 was isolated in a number of patients. This variant, called 501Y-V2, was found to be easily transmitted and was associated with high number of cases, leading to more severe cases, hospitalization, and deaths. It was found to be similar to the one that was isolated in Africa. The fast-changing epidemiology entails an increased disease burden that continues to negatively affect the socio-economic status of the country. The number of people requiring admission and specialist care in our facilities continues to escalate. This increased demand is overwhelming the health service delivery system and therefore has led to adjustments in the way of delivering these services. A home-based care system has thus been devised and is as follows. 1, those who test positive to COVID-19 but do not have complaints or symptoms, that is asymptomatic, are advised to self-isolate and be managed from their homes. They are expected to monitor themselves and report any changes that they may experience while in self-isolation. If they develop symptoms, they are supposed to report themselves to the nearest health facility for assessment. Once they are assessed at the health facility and are found to have mild symptoms not requiring admission, they are allowed to continue home isolation and monitoring of symptoms. If symptoms persist, they should go back to the health facility as soon as possible for further assessment. 2, while in home-based care management, the asymptomatic patients or those without symptoms, including those with very mild symptoms, are advised to use some home remedies such as the following: supplementation with vitamins, balanced diet with additional fruits and vegetables, taking plenty of fluids to ensure one is well hydrated at all times, engaging in light exercises, and steaming up, commonly known as ukufutikila in our local languages. Mr. Speaker, government has set up COVID-19 admission facilities across the country, including the private health facilities, where those who require admission are managed. There has been a downward trend in the number of those in admission countrywide, from over 500 at the peak of this second wave to the current average of about 435. However, Copperbelt province is seeing an increase in admissions. Majority of our inpatients, that is 70%, are still very sick and requiring oxygen therapy. Though the deaths have been reducing in the last week, we remain cautious as the situation may change anytime, and also the fact that those who are being admitted at this time are very sick. Mr. Speaker, the oxygen supply has been ramped up across the country in the main health facilities in Lusaka, Levy University Teaching Hospital, Maina Soko, the University Teaching Hospital. There is now adequate and reliable oxygen supply from the oxygen plants. Copperbelt has also received more support, with more oxygen cylinders being sent over to the province through various partner supports. We are still looking at means of having large oxygen plants on the Copperbelt and across the country as a long-term solution. And I must also point out that we're engaging key stakeholders for portable oxygen machines that will serve our rural areas better. Our patients in health facilities are being managed using various treatment regimens, including heparin, remdesivir, dexamethasone, and various antibiotics. Those that are critical require further interventions, such as plasmapheresis, which is basically blood purification, and do require albumin as well. The ministry is very active in looking at emerging data and evidence which can help manage those who are admitted, and will continue revising guidelines whenever new reliable evidence comes up. I therefore take this opportunity to thank our various cooperating partners and the United Nations family in Zambia for the great support we continue to receive in our COVID response. Mr. Speaker, government has guided that schools reopen cautiously as scheduled on the 1st of February 2021, following the 2 weeks which was given to enable preparations. In this, we are not applying a one-size-fits-all or a one-bullet theory, but we ensure that schools are assessed on a case-by-case basis as fit to enable learning to take place within the spirit of the 5 golden rules. The Ministry of Health staff at various levels have worked and will continue to work with various stakeholders, including the Ministries of General Education and Higher Education, to ensure that schools, colleges, and universities comply with the public health guidelines, and those not ready will not be allowed to operate, or those which are open but flouting these rules will be closed without hesitation. Mr. Speaker, I wish to emphasize that COVID-19 does not have a cure, and therefore prevention remains cardinal. The public health measures and the 5 golden rules must always be adhered to. These are: 1, masking up consistently and correctly in public. 2, hand hygiene, washing your hands with soap and water or using hand sanitizer. 3, social physical distancing. 4, avoiding crowded places wherever you can, and if you have no business to go about, staying at home. And 5, in case you have COVID, seeking medical care early when symptoms develop. It is very important for people to report to the nearest health facilities when symptoms develop in order to avoid late presentation. Our observations are that people who present early to health facilities tend to have better outcomes than those who present late when the oxygen saturation levels are very low and they have suffered hypoxic injury. I urge this august House and through it to the general public to adhere to this simple guidance. Mr. Speaker, as a preventive intervention, COVID-19 vaccines have since been developed and have shown to be effective and safe for use in the general populations. However, Zambia is consulting various stakeholders on the matter, and in addition, the Ministry of Health has set up a task force of local experts and scientists to advise on the whole process and ensure due diligence is done considering the safety and efficacy of the vaccines. Of late, this matter has attracted a lot of attention by the public. A cabinet memorandum on acquisition, deployment, and use of COVID-19 vaccines in Zambia has since been prepared and will be tabled in cabinet for consideration after which the nation will be informed of the next course of actions. And I want to assure Zambians that in the COVID-19 process, there shall be total transparency, accountability, and full information on efficacy and safety shall be availed. In short, there will be no backroom vaccine. Mr. Speaker, may I conclude by assuring this august House and the nation at large that government remains committed to ensuring the lives of Zambians are safe and the devastating social and economic effects of COVID-19 are adequately mitigated. Allow me to acknowledge the efforts and commitment of all the frontline health workers and responders who are working tirelessly beyond their call of duty to ensure the people of Zambia are well protected and cared for at all times. I also extend gratitude to all stakeholders who remain party to the prevention and control of COVID-19, including the honorable members of this august House who are our key ambassadors in the communities they represent. Additionally, I wish to request my fellow honorable members of the House to continue urging the members of their constituents to continuously observe the prescribed public health guidelines. Together, we shall conquer the COVID-19 pandemic. Mr. Speaker, I thank you.
Honorable members are now free to ask questions on points of clarification on the statement given by the Honorable Minister of Health. Honorable Member for Chimwemwe.
Mr. Speaker, I'd like to thank you. Honorable Minister, we've seen in some cases health personnel blocking or stopping border viewing of COVID-19 deaths. And also we've seen in other cases health personnel wrapping bodies in some plastic material because of them being COVID-19 deaths. So I would like to find out the correct ministerial position. Is border viewing allowed for COVID-19 deaths, and is it appropriate to cover bodies of COVID-19 deaths in some plastic material? Are there exceptions, or is it supposed to be for everybody? Thank you, Mr. Speaker.
The Honorable Minister of Health.
Thank you, Mr. Speaker, and I want to thank the Honorable Member for Chimwemwe for that very important question. I should mention, Mr. Speaker, that the pre-COVID world does not exist. We are now in the COVID and going towards the post-COVID world. So some things that customarily and traditionally we have always embraced, such as shaking hands, being crowded in places, funerals, kitchen parties, chilangamulilos, all these major events. The virus has taught us that some things have to change, otherwise we perish. That applies to what we call super spreader events, which include where people are crowded a lot. We are saying one of the golden rules is that avoid crowded places. Now I've seen, Mr. Speaker, even when I was on the Copper Belt where the honorable member comes from, people go to funerals packed in buses, in trucks. No one is wearing a face mask. And then from that event, what we get are cases going to Ndora Teaching Hospital, Kito Teaching Hospital. So in short, what we are saying, yes, we have to mourn with dignity, but we also have to listen to the guidance of the public health experts. When a person dies of COVID-19 and it's confirmed, the public health measures have to be put in place. Otherwise, you risk all the mourners getting infected. That applies also at the funeral house, even before you go to do body viewing. So we encourage that very few people should be at funerals, and even those who are there, they should observe the public health guidelines. Make sure that you are wearing a face mask at every funeral, at every gathering that you are, but we minimize the numbers. And then when it's a COVID death, because the virus has not died, it's still infectious. The human body is infectious. Even if you do preparations, we have to take the measures to make sure that we protect the public, including the bereaved family themselves. And I think we have very good examples. I should take this opportunity to thank the Catholic Church in Zambia, who have shown by example when we have lost high-profile priests in the Catholic Church, the way they have conducted the funerals, they have minimized the numbers, very few people attending, and observed all the public health guidelines. And that should be an example to all of us Zambians. So business as usual will not do in the midst of a pandemic. Mr. Speaker, I thank you.
Honorable Member for Ikilengi.
Thank you, Mr. Speaker. Thank you, Minister of Health. This is very important to the country as a whole. We thank you for this statement. It borders on our life in Zambia. It's non-political. Minister, what measures are you putting in place to stop those who are contravening the guidelines? I have an example in my constituency where us from the opposition have stopped and observed these guidelines, but those from the ruling party, the PF, they are going with business as usual. They are addressing public meetings without adherence to this COVID-19 issue. What measures are you putting in to see that non-political interference is adhered to? Thank you, Mr. Speaker.
The Honorable Minister of Health.
Thank you, Mr. Speaker. For a moment, I was wondering, is that the coke in the background in Ikering? Yeah, that is only a light moment. But, Mr. Speaker, let me say that the coronavirus is colorblind, is tribal blind, and does not know any political affiliation. And the people that we have lost in the country belong to all sections, political parties. I should mention that we are dealing with a generalized pandemic which has affected all the 10 provinces, all the districts of Zambia. And what we are saying, in fact, that's a very, very important question. This is an election year that we are in. His Excellency the President has directed the Minister of Health will be engaging with the Electoral Commission of Zambia to see what measures we need to put in place. We need to guide our political activists, just like we are guiding either traditional leaders, the church mother bodies that we have engaged with very, very closely, and we're engaging with the politicians. And I'm happy that even the UPND, the opposition UPND, has sought for advice in terms of how to conduct the National Convention, and that is very commendable. And we have engaged all the key civic and political leaders in the country to make sure that the pandemic does not devastate us. If you go to the hospital, you will not see UPND patients or PF patients, you see Zambian patients. So those who are there, and the statistics that we announce are not mere numbers. These are real people, our parents, our brothers, our sisters. So these who have no political tone will make sure that all Zambians adhere to these guidances that are being given. Otherwise, we risk the pandemic overwhelming the whole country. Thank you, Mr. Speaker.
Honorable Member for Dundumwezi.
Thank you very much, Mr. Speaker. And thank you very much, Honorable Minister, for that statement. Honorable Minister, I want to find out what are you doing to ensure that rural areas like Dundumwezi, especially in our rural clinics and health posts, have the testing kits for COVID-19. Because right now, when a person dies, they are just picked and then taken to the mortuaries, and the process of testing when these bodies are taken to the mortuaries is so cumbersome because they are not tested where they are coming from. So what are you doing to ensure that before a person is touched by any other person is tested at the point of death? I thank you.
The Honorable Minister of Health.
Thank you, Mr. Speaker, and I want to thank the Honorable Member for Dundumwezi for that very, very important point. Like I said, the health workers and the families are the most at risk, because when someone is sick, the first contact is by the families. They will not know that it's COVID, and that's why we're saying the fight against COVID will be on at the household level, at the community level. So these public health guidelines that we keep on announcing, once you see a suspicion, even a family member, you have to take the measures. Wear a mask, if possible, wear some gloves, but the virus is very easily transmissible within the household. For the health workers, we've lost a number of health workers. A number of health workers have been infected by COVID, and we've lost a lot of them, a number of doctors, nurses, and other categories, because they are the ones who are receiving the patients. So it doesn't matter at which level of care you are, at the family level, community level, the health worker, we have to ensure that we observe those prevention and control measures against COVID-19. So in short, I understand the issue about testing kits. The demand has outstripped the supply, and that is why I'm commending the cooperating partners for the support that they are giving to government. I must mention, Mr. Speaker, within the past few days, I've engaged actually maybe up to 6 ambassadors accredited to Zambia who are helping us. The U.S. Chargé d'Affaires, I've engaged the British High Commissioner, the European ambassador to Zambia, Chinese ambassador, Japanese ambassador, the French ambassador, a lot of our cooperating partners, including today I was with WHO and others. And we have been assured of more support in terms of diagnostic test kits, the personal protective equipment for our health workers. So I must assure our honorable member for Dundumwezi that through our district health directors and the provincial health directors, we are doing our best possible measures to ensure that every part of the country is touched. The last mile is touched. Thank you so much, Mr. Speaker.
Honorable Member Fulwena.
Thank you so much, Mr. Speaker. Honorable Minister, if you took a drive in our highly densely populated areas, you realize that adherence to face masking is not there. Social distancing is not there. In short, the 5 golden rules there is very low adherence to them. Now, my question to you, Honorable Minister, is, do you have any plans to make it mandatory that everyone who walks on the streets, goes to a public place, wherever they may be, except probably maybe in their private homes, should be seen to be wearing a mask, a face mask, so that we can see the reduction of this pandemic? Thank you.
Honorable Minister of Health.
Thank you so much, Mr. Speaker, and I want to thank the Honorable Member for Luena for that very important point, which we continue highlighting every day. Mr. Speaker, no Zambian today does not know what coronavirus disease is. Everyone knows about COVID because the messages are all there, the sensitization messages. But however, what is lacking is behavior change. It's one thing to have a message, it's another thing to change the behavior of human beings. And to change the behavior of human beings, it starts from us, ourselves. What example are we modeling ourselves as leaders, as key stakeholders? Every community has what we call community gatekeepers. If you're at a market, there's a market committee. If you're at a bus station, there's some form of organization there. In the traditional areas, we have village headmen, we have the traditional leaders, we have the church mother bodies. And Mr. Speaker, the government is engaging all these key stakeholders. Just last week, myself and the Minister of National Guidance and Religious Affairs were engaging all the church mother bodies in Zambia, because everyone in this country belongs to a church. And the church has to take a leading role, and I'm very happy that they have taken that leading role to ensure that all of us church members, whatever our religious affiliation, are taking those measures. We've done the same with the Islamic groups, the Hindus and others. Yesterday, I had traditional leaders from some parts of the country coming, and everyone is affected by COVID. So to me, behavior change will come when we personalize it ourselves. The fight against COVID is not only a fight for the Minister of Health, it's for every Zambian to take individual responsibility. We should take individual responsibility in our homes, where we are coming from, so that if people that we live with are not complying, we should be the first ones to tell them, why are you not wearing a mask? Why are you not washing hands? Why are you going to that crowded place? So it starts from the home, the neighborhood, goes to the community, and goes to the country. So change, the fight against COVID in short, will be on at the community level. It will not be on at a facility or hospital level. Because by the time someone comes to a facility, it shows that the community has failed. Spread is happening. So I would urge all of us, especially as members of parliament who represent the 18 million Zambians, to also take a very active role in sensitizing our people, the councillors, the religious leaders, everyone. It is our fight. Mr. Speaker, I thank you.
Honorable Minister of Health, the question was, are you planning or contemplating making the wearing of masks compulsory in public?
Thank you, Mr. Speaker. I think that's part B of the question because initially it started with the high density areas. But however, I appreciate when we say wear a mask in public consistent and correctly, we avoid using the word mandatory because mandatory has a connotation of enforcement. That is why we can say in policing. We've seen countries where these activities are policed. And we've seen some countries I can't mention where more people died from the police than from the virus. So from our experience as scientists, we don't believe that policing is the effective way to fight the coronavirus. It's behavior change. Because even if we said we make the wearing of a mask mandatory, the question comes on enforcement. And when people in their houses, who is going to monitor whether they're wearing a face mask? Because people will hide, they'll impress a policeman wear a mask, immediately the policeman goes, they'll drop it down and will not defeat the problem. So in the end, the first line of defense is behavior change for everyone. Mandatory face masking currently is not on our books as a government. Thank you, Mr. Speaker.
Honorable Member for Mongu Central.
Thank you, Mr. Speaker. And thank you, Minister, for your very clear statement. Minister, you have indicated that 70%